Ovarian cancer, the person doesn't walk into your clinic and say, कि, शायद मुझे ovarian cancer है. It doesn't happen. The symptoms the woman comes to you with are also very vague symptoms. So the symptoms of ovarian cancer are bloating, pain in abdomen, maybe change in her menstrual cycles, increased frequency in micturition, that is urination. So these are all very vague symptoms. Even if a woman does walk into a OPD for a medical or a gynac doctor, the first thing that's going to come to your mind is not ovarian cancer when she gives you these symptoms.
Because these symptoms are really generic also.
Exactly, they're very generic symptoms. So you're going to try and rule out other issues, other problems before you as a doctor also think about ovarian cancer. Unless she comes to you with a strong positive family history of ovarian cancer or any other female reproductive cancers in the family, if she herself is a cancer survivor, okay, then if any cancer survivor walks into your clinic, you do think of cancer as one of your priorities and diagnosis for any symptoms. You do try and rule it out first.
Right.
And because ovarian cancer gets detected late, unfortunately, that is the reason ovarian cancer has a very high morbid and mortality rate.
Right. Yeah. Okay, those chances are really high
in comparison to other cancers, yes, because it gets detected late, right? It's just like a ratio.